Welcome back to the deep dive. We get a lot of requests, and one that pops up a lot is childhood and adolescent depression. So today we're going to tackle it head on.
Yeah, it's a big one.
It is. It's a really big one. And thankfully, we've got this child psychopathology textbook that we're going to be using.
Perfect.
Yeah, it's going to be our guide through all the different types of depression, and how they show up in kids of different ages.
Yeah, because it can be really different.
Right. Like what depression looks like in a 5-year-old is going to be way different than in a teenager.
Exactly.
So we're going to unpack that. And then, of course, all the challenges that depression brings for the kids themselves, for their families.
Right. And then we need to talk about what causes it.
Oh, yeah. That's a whole other can of worms.
It really is. It's so complex.
But we're gonna get into all that.
Yep.
And then what can we do about it? What are the treatments? What are the supports that can help?
Because there's a lot of hope. Like, there are things that work.
There are, absolutely. So this deep dive is kind of like your crash course on childhood and adolescent depression.
Like your cheat sheet to understanding it all.
Exactly. All right, so the textbook starts off with this case study of a 12-year-old girl named Donna. She's struggling with Major Depressive Disorder, MDD.
Right.
And her story really highlights, like, how depression in young people, it's not just about feeling sad.
Right. Oh, not at all.
It's like it affects their whole world.
Their school, their relationships, even their physical health.
And then the textbook contrasts Donna's experience with this 16-year-old named Mick.
Uh-huh.
And he has bipolar disorder.
So very different.
Very different. And this really highlights the less common, but just as serious experience of, the extreme highs and lows.
Right. Those mood swings.
Yeah.
That can be so disruptive.
So even within a similar age group, depression can look so different. I mean, that must make it even more challenging to recognize and diagnose.
Oh, absolutely. And the textbook mentions some other types of depressive disorders too, like persistent depressive disorder.
PDD?
Yeah, PDD. And then there's this new one, disruptive mood dysregulation disorder.
DMDD.
Yeah, DMDD. That's a newer one. A little controversial. We'll get into that later.
We'll definitely circle back to all of those. But first, I think it's important to really emphasize how, like, the way depression shows up, it could be really different depending on the kid's age, right?
Oh, for sure. Kids express themselves so differently at different stages.
So I'm curious, like, how might depression look in, let's say, a toddler versus, like, a teenager?
Okay, well, the textbook gives these great examples. So picture a baby who's just unusually passive and unresponsive. Could actually be a sign of depression.
Wow. I never would have thought of that.
Right. And then as kids get a bit older, say preschool age, they might start withdrawing from others or become really inhibited.
Okay.
And then when you get to school age kids, you might see more irritability or even aggression.
Oh, that's interesting.
Yeah, which could easily be mistaken for something else.
Right, ADHD or something like that.
Exactly. And then in teenagers, that's when you often see those more classic symptoms of like intense guilt, hopelessness, self-blame.
Right. The more sort of stereotypical, I guess, symptoms.
Right.
So, I mean, depression really does speak different languages depending on the kid's age.
It does, yeah.
Recognizing these different, what did you call them?
I call them dialects, I think.
Dialects, yes. Recognizing these different dialects of depression. That must be so important for parents, for teachers, for anyone who works with kids.
I completely agree. Early detection is key, but it's hard if you don't know what you're looking for.
Yeah, absolutely. Okay, so let's go back to MDD for a bit. The textbook introduces us to Joey, he's 10, and Allison, she's 17.
Right, different ends of the spectrum.
And they kind of illustrate the range of ways that MDD can manifest.
Yeah, like Joey struggles with anger outbursts, and he has a really hard time concentrating. And then Allison, she describes this like profound emptiness and hopelessness.
So different experiences, same diagnosis.
Exactly.
And I see here that the textbook, it actually gets into the nitty-gritty of the DSM-5-TR criteria for diagnosing MDD. But applying those criteria to kids and teens, I imagine that's not always straightforward.
You're right. It's not just a checklist. You have to consider the developmental context.
So what are some of the things that make it tricky?
Well, one thing that's fascinating is that sometimes a kid's disruptive behaviors, like acting out or getting in trouble, can actually mask their internal suffering.
So it's like their behavior is a cry for help, but we might be misinterpreting it.
Exactly. And we need to look beyond the surface.
Yeah, definitely. And I mean, the textbook also really emphasizes that, like, depression can significantly impair a child's ability to function, in their daily life.
Yeah, it affects everything. School, relationships, hobbies, even basic self-care.
Right. Right. It's not something to be taken lightly. It sounds like a condition that can cast a long shadow, too, because the textbook means that even after recovering from one episode, there's a high chance of it coming back, recurring.
Unfortunately, that's true. The statistic that jumped out at me was there's a 70% chance of recurrence within 5 years.
Wow. That's really high.
It is. And the textbook explains this in terms of something called stress sensitization.
Stress sensitization.
Yeah. Basically, it means that first episode of depression, it actually makes the person more vulnerable to future episodes, even from like seemingly minor stressors.
Oh, that makes sense. So it's almost like priming their system, making them more sensitive to stress.
That's a good way to think about it.
And then we also see this really concerning pattern of girls being twice as likely as boys to experience depression after puberty.
Yeah, that's a big one.
Why is that? Does it shed any light on that gender difference?
It does, yeah. It dives into a few possible explanations. So one is something called the gender intensification hypothesis, which suggests that as girls go through puberty, those societal pressures intensify, right? And they start internalizing those pressures, leading to more rumination, more self-blame.
Yeah. It makes me think about how, like, girls are often encouraged to be more emotionally expressive,
Right.
while boys are told to toughen up.
Exactly. So girls might be more likely to like dwell on their feelings while boys kind of push them down.
Right. And then that can lead to those unhealthy coping mechanisms.
Right. And the textbook talks about how girls tend to internalize their distress, leading to those patterns of rumination and self-blame, whereas boys are more likely to externalize it through anger or aggression.
So it's like they're both struggling, but their ways of coping can actually mask the underlying depression.
Absolutely.
Okay, so we've talked about gender. What about the role of, like, culture and ethnicity?
Yeah, that's a good question. The research on that is still pretty limited.
Okay.
But the textbook does acknowledge that socioeconomic factors can play a significant role.
Makes sense.
Yeah, because lower socioeconomic status often means higher stress levels, less access to resources, which can create a kind of perfect storm for vulnerability to depression.
Right, like a cascade of risk factors.
Exactly.
Okay, so we've spent a lot of time talking about MDD, Major Depressive Disorder. But let's shift gears now to talk about Persistent Depressive Disorder.
Or PDD.
PDD. So what makes this type of depression different?
Well, the textbook introduces us to Deborah, and her experience really helps illustrate the key features of PDD. So it's chronic, meaning it lasts for a long time. But the symptoms are generally less severe than MDD.
So it's like this constant low-grade sadness that kind of permeates their life.
Exactly. It's like this gray cloud that just hangs over them.
Right, and I imagine it can be really hard to distinguish PDD from just a personality style, like someone who's just kind of, naturally more pessimistic or negative.
Yeah, that's one of the challenges the textbook highlights. It's not about someone just being a negative Nancy. It's a real condition that impacts their whole life.
Gotcha. And then there's disruptive mood dysregulation disorder, DMDD.
Right.
That's a relatively new diagnosis, right?
It is, and it's been a bit controversial, as you can imagine, because some people argue that it's pathologizing temper tantrum that might be developmentally normal in kids.
I could see how that would be a concern.
Yeah, so the textbook acknowledges that we need more research to really understand DMDD and how it's distinct from other mood and behavior disorders.
Okay, so we've got this whole spectrum of depressive disorders, each with its own kind of unique presentation, its own unique challenges. But the impact goes beyond just mood, doesn't it?
No, absolutely not. The textbook emphasizes that depression has this ripple effect. It impacts a young person's intellectual functioning, their academic performance, their social skills. It even affects their family relationships.
It really does paint a picture of how pervasive depression can be. And I remember the textbook shared Ellie's experience of feeling worthless.
Right.
And that led into a discussion about cognitive biases and distortions.
Yes, and that's a key concept to understand.
So explain that a little bit.
Okay. So basically, depressed children tend to have this negative filter on their experiences. So they focus on the bad stuff, they misinterpret situations, and they get stuck in this loop of self-criticism.
It sounds like a vicious cycle.
It really is. And the textbook even has a term for it. Depressive ruminative style.
Depressive ruminative style. Okay.
Yeah. So it's like they're constantly chewing on these negative thoughts.
Okay, so like a cow with its cud.
Yeah, exactly. Just stuck in that loop.
And it can be hard to break free.
So hard. And the textbook also highlights the impact of low and unstable self-esteem,
Hmm.
which is so common in depression. And they share Farah's story, which really shows that even kids who seem successful on the outside can be struggling with these deep feelings of inadequacy.
Right, so we can't always judge a book by its cover, so to speak.
Exactly.
And what about the social challenges? Like, how does depression affect how kids interact with others?
Well, the textbook points out that depressed youth often struggle with social problem solving,
Okay.
and they have a harder time forming those healthy coping mechanisms. They talk about this phenomenon called co-rumination.
Co-rumination.
Yeah, it's basically when friends dwell on negative thoughts and feelings together.
Hmm.
So it might seem supportive on the surface.
Like they're bonding over their shared struggles.
Exactly, but it can actually increase the risk of depression for everyone involved.
Oh, wow. So they're feeding off of each other's negativity.
Exactly, it's like a downward spiral.
And then, of course, there's the impact on family relationships, which is huge.
Huge. The textbook emphasizes that families with a depressed child, they often fall into these negative interaction patterns.
Uh-huh.
So communication breaks down, frustrations build, and it becomes this really difficult cycle to break.
It sounds incredibly challenging for everyone involved.
It is. For the child, for the parents, for siblings.
And then, of course, we have to address the elephant in the room, the link between depression and suicide.
Right. It's a tough topic, but it's a crucial one to talk about.
Absolutely. In the textbook, it shares Carla's story, a young woman who attempted suicide.
Right. And her story is just a stark reminder of that very real connection between depression and suicidal thoughts.
And they share excerpts from Terry's suicide note, too.
Yes.
Which really just lays bare that profound sense of hopelessness that can drive a young person to such extremes.
It's heartbreaking to read.
It is, it is. And while suicide is, thankfully, relatively rare in younger children, the risk increases sharply during adolescence.
Yeah.
So understanding the warning signs and getting help early is absolutely critical.
It can literally be life-saving.
It sounds like we've only just scratched the surface of this complex topic.
We have. There's so much more to uncover. We need to talk about the causes of depression, the different approaches to treatment.
Well, I'm definitely ready to dive deeper. Okay, so we've talked about all the different ways depression can show up, and how it can impact kids' lives. But now I'm really curious about what causes it. Like, what are the roots of this? And the textbook makes it pretty clear that there's no simple answer. There's no single things that causes depression.
Right. It's definitely not like that. There's no, one-size-fits-all explanation.
Gotcha, gotcha. So it seems like it's more of a tangled web of influences, right?
Yeah, that's a great way to put it. And actually, the textbook even uses this image of a web, like literally a spider web.
Oh, wow. Okay.
Yeah, to represent all these different factors that kind of intertwine. You've got genetic predisposition, neurobiological factors, family dynamics, stressful life events, even individual coping styles, they all play a role.
So it's not nature versus nurture. It's like nature and nurture all tangled up together.
Yeah, exactly.
So where do we even begin to, unravel this web?
Well, the textbook, it dives into a bunch of different theoretical perspectives, which
Yeah.
is really interesting.
Okay.
And, each one kind of offers a piece of the puzzle. So you've got psychodynamic theories,
Okay.
and those focus on early loss and unresolved conflict as potential contributors to depression.
Okay.
And then there's attachment theory, which, that really emphasizes those early caregiver relationships and how important they are.
Right, right.
And of course, we can't forget about behavioral and cognitive theories,
Okay.
which, those focus on learned patterns of behavior and thinking.
So many different lenses to look at this through. It seems like each theory kind of highlights a different thread in that web, right?
Exactly. And there's even more than that. We've got interpersonal theories.
Okay.
Which those really zero in on the role of social relationships in depression.
Uh-huh.
And then you've got socio-environmental models, and those zoom out to look at the bigger picture, the impact of stressful life events.
So it's like you need all these different viewpoints to really get a handle on how complex this is.
Right. Yeah, exactly.
But is there a model that tries to bring all those threads together, try to make sense of how they all interact?
Yes, there is. And the textbook highlights this one called the diathesis stress model.
Diathesis stress model.
Okay. And basically what that model suggests is that depression often arises from this interplay between a person's inherent vulnerabilities,
Okay.
which they call diathesis,
Uh-huh.
and the stress they encounter in their environment.
Gotcha. So, someone might have a genetic predisposition to depression,
Right.
but it might not actually manifest unless they also experience, like, a major life stressor.
Exactly. Like a job loss, a death in the family, or even just like the everyday pressures of school or work.
So it's like the genes might load the gun,
Yeah,
but the environmental stress, that's what pulls the trigger.
that's a great analogy.
It really shows how important it is to understand both, those individual vulnerabilities and the stuff that's going on in their environment.
Right, it's both.
Okay, so let's break down some of these contributing factors. So the textbook mentions that depression has a moderate heritability, like around 30 to 45%.
Right, right.
So what does that mean in practical terms? Like, what does that tell us?
Well, it basically means that genes definitely play a role,
Uh-huh.
but they're not the whole story. It's not like inheriting like eye color. It's not a guarantee.
Right, right.
And the textbook, it actually shares Jessie's story to kind of illustrate this. So her dad, he struggled with bipolar disorder,
Okay.
and then she ended up developing depression in her teens.
Oh,
But it shows how family history can like increase a child's risk, but it doesn't automatically mean that they'll develop a mood disorder.
right. It's like that loaded gun analogy again, right?
Exactly.
The genes might load the gun, but something else has to happen to make it fire.
Right, right.
So we've talked about genes. What about, like, the brain itself? How is the brain involved in all of this?
Okay, so research has actually pinpointed several key brain regions that are involved in emotional regulation. So, the amygdala, the hippocampus, and the prefrontal cortex. Those are the big ones.
Okay.
And what's really interesting is that those regions, they seem to function differently in people with depression.
So it's like the brain's emotional control center is kind of out of whack.
Yeah, that's a good way to think about it. And then the textbook also gets into the HPA axis.
HPA axis.
Yeah, it stands for hypothalamic pituitary adrenal axis.
Oh, okay.
But basically, it's the body's stress response system.
Okay.
And what's fascinating is that early exposure to stress, like, childhood trauma or neglect, can actually disrupt the development of this system, which then makes the person more vulnerable to depression later in life.
Oh, wow. So if your stress response is just constantly on high alert,
Right.
it can lead to those feelings of anxiety and depression.
Exactly.
And then, we can't forget about the impact of family dynamics, which I think is huge.
Absolutely. And the textbook really emphasizes how challenging it can be for a child to grow up with a depressed parent.
Yeah, the textbook shared Mrs. D's story. And, she was dealing with depression and really struggling to be an effective parent.
Right, right.
It just sounds like an incredibly tough situation for her kids to be in.
It is. And research shows that kids of depressed parents, they're not only at higher risk for developing depression themselves, they're also more likely to have other mental health issues. So it's like this cycle of vulnerability.
That can be passed down.
Exactly.
It really emphasizes how important early intervention and support is, for families who are dealing with these challenges.
Yeah, I totally agree. Early support can make a huge difference.
Yeah. And then the textbook also talked about the impact of stressful life events.
Right.
Which could be anything, from, like, major traumas, like the death of a loved one, to, like, more everyday stressors, like arguments with friends or, like, academic pressure.
Right. And even those, like, seemingly small events can trigger bigger things.
Yeah, I remember the textbook talked about Caroline's story.
Yeah.
And how, like, even small things would trigger those depressive episodes.
Right. Which just shows how important it is to understand individual triggers.
Right, because everyone's different.
Exactly. And then last but not least, there's the role of emotion regulation,
Okay.
which the textbook talks about. If a child struggles to manage those difficult emotions, like anger, sadness, frustration, they're much more likely to feel overwhelmed and fall into a depressive state.
Yeah, so it's like they're lacking those skills to navigate, the rough emotional waters of life.
Exactly. They don't have the tools.
So it seems like we've covered a lot of ground here. Like, all this interplay of genes, brain function, family stuff, life experiences. It's a lot.
It is a lot. It's a lot to take in, but understanding all those different pieces, it's really key to figuring out how to help.
Right, right. Now I'm really curious to dig into solutions, those interventions. Like, what does the textbook say about how we actually treat depression in young people?
Well, the textbook emphasizes that breaking that cycle of depression, it takes a multifaceted approach. Like there's no magic bullet, no one-size-fits-all solution.
Right, of course.
The treatment really needs to be tailored to the individual child's needs and their situation. You know what I mean?
Yeah, for sure. So what are some of the main approaches? Like, what does the textbook highlight?
Okay, so the two main categories are psychotherapy and medication.
Mm-hmm.
And the textbook really emphasizes how important early intervention is and also ongoing support.
Yeah.
And they dive into the effectiveness of cognitive behavioral therapy.
CBT.
Yeah, CBT, and how that can really help kids identify and change those negative thought patterns that we were talking about earlier and help them develop those healthier coping mechanisms.
So it's like rewiring those thought circuits and giving them new tools to manage all the emotions.
Exactly.
Love that.
And there are a bunch of specific CBT programs, actually, that have been designed for kids and adolescents. So one that they mention is PASET.
PASET?
Yeah, which stands for Primary and Secondary Control Enhancement Training.
Wow, okay.
I know, it's a mouthful. But basically what it does is it focuses on teaching kids how to, take charge of the things they can directly control in their lives.
Uh-huh.
And then also how to think and feel about the things that they can't control.
So it's about empowerment.
Yeah, exactly. It's about giving them that sense of agency.
Love it. Are there other programs like that?
Oh, yeah, there's tons. There's the ACTION program.
Action.
Yeah, which that one's really cool because it involves both the child and their parents.
Oh, okay.
And it teaches kids to, be active in managing their moods, to savor those positive moments, to view challenges as problems to be solved, and to avoid getting stuck in that negative thinking.
I love that. I love that it's called Action, too. It's very action-oriented.
Right. It's all about taking action.
What other ones do they mention?
Let's see. There's Coping with Depression Adolescent, or CWDA.
Okay.
And that one focuses on, giving teenagers very specific skills for managing depression. So increasing pleasurable activities, promoting positive thinking, improving social skills, and problem-solving skills. It's very hands-on.
It sounds like these programs, they really give kids a whole toolkit for dealing with this stuff.
They do. They really do. And then there's interpersonal psychotherapy for adolescents, or IPTA.
IPTA, okay.
And that one, it zeroes in on improving social skills and communication.
Okay.
So it helps teenagers understand how their relationships influence their mood and vice versa.
Makes sense.
So it teaches them to communicate their feelings better, to navigate conflict in a healthier way.
It's all about the social and relational aspects of depression.
Exactly.
Which, makes sense because those relationships are so important. So we've talked about therapy. What about medication? Does the textbook talk about that?
Yes, it does. And it mentions that selective serotonin reuptake inhibitors.
SSRIs.
Yeah, SFRIs, they're often used to treat depression in young people.
Okay.
But it also acknowledges this ongoing debate about their effectiveness and also the potential for side effects, which is important.
Yeah, that's a big one. There are always concerns about over-medicating kids, especially when it comes to mental health.
Right. It's a delicate balance, and the textbook really stresses that medication should always be part of a bigger treatment plan.
Okay.
Ideally in conjunction with therapy, family support, all that good stuff.
So it's not just about popping a pill and hoping for the best.
No, definitely not. And it also mentions other treatment approaches, like some that focus on teaching self-control skills, building social support networks, improving family relationships, even school-based prevention programs.
So many different avenues to explore.
There are, yeah.
It seems like, taking a multi-pronged approach, like addressing the individual, their family, their environment, that's key to really tackling this, right?
Oh, absolutely. It takes a village, so to speak.
Before we wrap up the textbook, I remember briefly mentioned bipolar disorder in youth.
Right.
And it seems like that's a whole other beast that probably deserves its own deep dive.
You're right. Bipolar disorder is a very complex and distinct condition.
Yeah.
And the textbook introduced Ben. He's 14.
Okay.
And he was experiencing those extreme mood swings that really characterize bipolar disorder.
Yeah, those highs and lows could be so intense.
They can be, yeah. And it can be really tough to diagnose in kids and teenagers, too.
Oh, why is that?
Well, because the symptoms can overlap with other disorders, like ADHD, for example.
Oh, okay.
So it can be tricky to tease apart.
So while we're not going to dive deep into bipolar disorder today,
right,
it's definitely something important to acknowledge.
Mm-hmm.
And, maybe we can do a whole episode on that sometime soon.
That would be great. It's definitely a topic that deserves its own deep dive.
For sure. But for now, let's circle back to depression. And, What are some key takeaways you hope our listeners will lose away with?
Okay, well, first and foremost, I hope they remember that depression is not a sign of weakness.
Absolutely.
And it's not something to be ashamed of. It's a real medical condition. It can affect anyone. And the good news is it's treatable.
Wow, we've really covered a lot of ground here. All these different types of depression, from like the depths of major depressive disorder
Mm,
to the chronic struggles of PDD. We even touched on bipolar disorder.
right, right. We've been all over the map.
And then we got into those like really intricate causes, genes, environment, family stuff, stressful life events. It really is a lot to take in.
It is, yeah. It's a lot. But I think it shows how important it is to be like holistic in our understanding of depression, especially in kids and teens. It's not just one thing.
Right, right. It's never just one thing. It's always this like combination of factors. But honestly, it's been a little heavy, talking about all this. So I'm curious, does the textbook offer any hope? What does it say about treatment and recovery?
Yeah, well, the good news is the textbook really emphasizes that depression, while it can be incredibly debilitating, it's treatable. Like young people can and do recover from this.
That's so good to hear. I mean, we've talked about all these different approaches, right? Like cognitive behavioral therapy, interpersonal psychotherapy, even medication in some cases.
Yeah, it's about finding that right combination of tools and strategies that works for each individual. And often it involves a lot of collaboration, like the therapist, the parents, the teachers, and of course the young person themselves. They all have to work together to create that supportive environment.
Yeah. And I remember the textbook specifically mentioned how important it is to address those family dynamics too.
Oh, for sure.
Like it's not about blaming parents,
Right.
but it's about understanding that a child's depression often reflects kind of those broader struggles within the family system.
Absolutely. And when parents have the knowledge and the skills to support their child's emotional well-being, it can make a huge difference.
Yeah, like it's about empowering families to be a part of that solution. So we talked about, therapists, parents. What about schools? Like what role do schools play in all of
Oh,
this?
a huge role, a huge role. And the textbook, it talks about school-based prevention programs and the need for early detection efforts because schools, they're often on the front lines. They see these kids every day.
Right.
So they have a unique opportunity to create that culture of support and to reduce the stigma around mental health.
I was just thinking, like, imagine a school where kids felt comfortable actually talking about their struggles. Where mental health was treated with the same importance as physical health.
Yeah, that would be amazing. That would be a game changer. It would. It would take some systemic changes for sure, and, a real commitment to funding those mental health services within schools. But I think it's an investment that's worth making.
Absolutely. Okay, so as we wrap up this deep dive into depression and young people, what are some like key takeaways? Like what do you hope our listeners will remember from all of this?
Okay, I think the biggest one is just remembering that depression isn't a weakness
Hmm.
and it's not something to be ashamed of. It's a real condition. It can affect anyone. And thankfully, it's treatable.
So important to remember that. It's not about like toughening up or snapping out of it.
No, not at all. It's about getting help and it's about getting support.
And it's okay to ask for help, right?
Oh, absolutely. In fact, I think asking for help is a sign of strength. It shows self-awareness, and there are so many resources out there from therapy to support groups to medication. The right combination can make a world of difference.
Yeah, for sure. And I think it's important to emphasize that early intervention is key. The sooner we recognize those signs and seek help, the better the outcomes tend to be.
100%. And lastly, I hope they feel empowered to advocate for mental health awareness, in their own communities, whether it's talking to friends and family or volunteering with an organization or even just like pushing for better mental health services in schools. Like every action, big or small, can help create a more supportive and understanding environment for those who are struggling.
That's beautifully said. This has been such a thought-provoking deep dive. I feel like I've learned so much. So thank you for sharing all your wisdom with us.
It's been my pleasure. And, the conversation doesn't end here. Keep learning, keep asking questions, and keep advocating for mental health.
Yes, absolutely. And to our listeners, thank you for joining us on this deep dive. We hope you found it helpful, informative, and maybe even a little bit empowering. And remember, you're not alone on this journey. There's help available, and there's always hope.